Welcome everybody to our fourth video in the series of standing poses of Soma Yoga's anatomy and physiology analysis. So we've looked at a variety of standing poses already in the first three videos, and today we're going to choose to look at two more which have a balancing aspect to them. So the first one is Ardha Candrāsana, which is half moon pose. And the second one is Vīrabhadrāsana 3, which is a warrior 3 pose. So we're going to begin with Ardha Candrāsana, half moon pose. And this is actually quite a lot trickier, this pose, than it looks. So for a lot of people, balancing is going to be quite challenging. But we're going to show some modifications as well as we go along. So Gabby's going to demonstrate this pose. So the first thing, that's it. So for many people, in order to be able to get this rotation and get this position with the shoulder, hip, leg in one straight line, then you're going to need to have the hand raised. Now, how high depends really on the length of your arms, the length of your torso. So if you have extremely long arms, you might find you're virtually in this position without a block. But for most people, no, a block is a useful tool to have under the arm. So the first thing to notice is the standing leg. So we want to straighten the standing leg. So the quadricep muscle here has to fire up, squeezing that quadricep muscle to fire up the standing leg. Yeah, and then we're using muscles, just come down for a moment, Gabby, to have a rest. Yeah, we're using muscles, so you can bring this foot forward, on the lower leg in order to stabilize this foot. So we're using muscles, the tibialis posterior, which helps to push the foot down, plantar flexion, as well as the peroneal muscles. There's two of them, sometimes called the fibularis, sometimes called the peroneus, and there's a long one and a short one, longus and brevis. And these, again, when they contract, they're going to help plant the foot down and stop it from falling over. Yeah, which is really important when we're balancing on one foot. So we've got to engage muscles in the lower leg, we've got to engage muscles in the quadricep, yeah, and then as when we're in the pose, we're going to be getting this stretching in the hamstrings and in the adductors on the inside of the front leg. So come back in. So now we're going to go into the pose with the hand coming all the way down to the floor. I'm just going to support Gabby's leg, just as it's quite tiring to hold this while I talk for ages. And you'll notice the angle has changed here. So now the shoulder is slightly below the line of the hip, which is slightly below the line of the foot. So it's going upwards in one straight line. The back leg's also straight, so the quadriceps being squeezed in the back leg. And here, she's flexing and pointing the toes towards the side. And by doing that flexing, she's using the tibialis anterior to dorsiflex, and she's using those peroneus muscles to stop the foot from rotating inwards, yeah? So that's a nice shape. So the sole of the foot is pointing directly back here. Then she's scooping that right buttock under using the gluteus maximus, and also some of the smaller hip external rotators. So let's come back up and take a rest for a moment. So those are the two key areas of the legs. Yeah, so we've seen, again, it's a lateral motion. Yeah, we're going into the lateral plane. So Gabby, why don't we face the other way this time? That's it. And then if we look on the torso, again, Gabby's rotated her chest. She's pulling the belly in, so the transverse abdominis, those deep muscles working. So, and then we've got a combination, basically here, we have a combination of both the erector spinae muscles and the erectus abdominis muscles working together to stabilize the body, to stabilize the trunk. The arms are abducting, they're coming away from the body, from the center line, so they're abducting away using mainly the mid-deltoid. And then the head, eventually we want to turn the head up to look towards the upper arm. So this is the full pose. Now, for many people, this is going to be very hard to hold and to balance. So come back up again, Gabby. For many people, this is going to be challenging. Firstly, they're going to have difficulty keeping the standing leg straight because the hamstrings are going to be tight. So if that's you, by using a block, as Gabby was showing earlier, by using a block, you're not going to stretch the hamstrings as much because you're not going to go as low. So the hamstrings on the standing leg are not being stretched as much. And similarly, with this leg in a more parallel line to the mat, you're also not stretching into the adductors on the inside of the legs. You're not getting as much stretch either in those. Now, if you're having difficulty in this position, keep that leg straight, but you can bend the standing leg a little bit, just a little bend in the standing leg. And maybe with this top hand, you can just bring the hand onto the hip, there, into this position here. And then the head, again, just as with the other poses, you can turn the head to look forward or even look down towards the floor. And that's going to be an easier position to hold your half moon pose in. Ardha Candrāsana. Come on back up, Gabby. So, quite a hard pose to hold for any length of time. If you want a more passive version of that, you can always put the raised leg onto the back of a chair. You could put the raised foot onto a wall. You can even stand by a wall and just lean against the wall with your body so that you have some support. So if balance is an issue for you, either putting a hand on the wall or turning the whole body against the wall so your back is on the wall, then you're not going to fall backwards. One of the things that we also tend to see is that the raised leg, sometimes people have the raised leg going backwards. If you can't see your toes, so if you could come back down one more time, we can use the block. So Gabby's foot is in a nice line there, but sometimes I'll see students and their legs back here, and there's no way they could see their toe. They're arching in their chest, and the back foot is too far back. So we want to keep that straight line in one plane of motion, so that if Gabby looked back, she'd be able to see her big toe. Can you see your big toe? Yep. So that's what we want, in half moon pose. Not that opening up into a back bend in this pose. And back up we go. And that is Ardha Candrāsana half moon pose. And now we're going to take a look at another balancing pose called Vīrabhadrāsana 3, Warrior 3. This is another balancing pose where we're standing on one leg. And the standing leg, really the action of the muscles in the standing leg is very similar to what we just looked at in Ardha Candrāsana. So I'm not going to go through all of those muscles again. I would just mention that because of the change of the hip position, which you'll see in a moment from Gabby, there's less stretch going on in the adductor muscles. So the inside of your standing leg isn't being stretched as much, nor in fact is the inside of your raised leg. This is working more into the hip flexors, less into the adductors on the inside of the legs. So Gabby, if you'd like to come into your Warrior 3 pose. So in Warrior 3, if you flex the back foot, flex it, that's it, toes pointing down towards the floor. Now, in this pose here, ideally we want to try to keep the standing leg as straight as possible, with the arms extending forward as Gabby is, pulling the lower belly in, using the muscles in the erector spinae to extend the spine. Now, for many of you, it's going to be very, very hard to hold this position. So bring the hands to your heart center is a nice modification, makes it easier. Yeah, and particularly if you're tight in the shoulders, tight in the chest, that's going to be an easier position. You can do airplane arms, for example, and just extend the arms back. That's another alternative. So in this pose here, you can come up, swap sides, yeah, other side. And let's keep the hands at the heart center for now. So in this pose here, before in half moon pose, we had the hips open. Here you'll notice the hips are closing more, but the raised hip is still slightly higher on the raised leg side than the other side. And this is important, especially for ladies who've got wider hips, because if you try and turn the hips level like that, it puts a huge amount of strain on the ligaments, particularly the iliofemoral ligaments on the outside of your standing leg. So having this hip just slightly higher while still internally rotating the thigh so that the toes point down towards the floor, yeah, is still the position we're looking for. If Gabby straightens her arms out forward, extending forward, again, external rotation of the arms, using those lower trap muscles to keep the space between the ear and the shoulders, and those deltoid muscles working hard to keep the arms up. Coming back up again. And that is the full pose of Warrior 3. So I gave a couple of examples there of modifications, but even for some people that's going to be very challenging. Having your hands at your heart center, having your hands in airplane arms can still be very challenging. So again, we can use props. If you want a slightly more passive version of the Warrior 3, you can put a chair in front of you and you can bring your arms and just rest your arms on the top of the chair. That's going to take out some of the stress on the shoulders. And particularly if you're tight in the chest and your ability to do shoulder flexion is limited, then having the arms resting on a chair is going to make that easier. Similarly, if you're finding it very difficult to get your leg up, so if you go into the pose, Gabby, just do the one with the hands at the heart center, simple version. See here, now here the leg's much lower. So for some people, they may need to bend this knee. They won't be able to get that leg up so high. So either because they've got weaker gluteus medius and gluteus maximus muscles, the posterior fibers of the gluteus medius are helping the gluteus maximus pull up. But the anterior muscle, or the anterior fibers of the gluteus medius are stopping the rotation outwards of the leg, keeping it pointing downwards. But you could have that back foot resting on the top of a chair or pressing the foot into the wall, for example. So there's always ways that we can make it easy, but ultimately both Ardha Candrāsana half moon pose that we just demonstrated before and Warrior 3, ultimately the full pose is a balancing pose working on the middle of the room. But as we progress, we may, in the early stages, we may want to use the wall, a chair, something to help us. And as I said, reducing the arm position inwards more, closer to the body, is going to make it easier to balance than if you extend the arms all the way forward like Gabby was doing in the full pose. So there we have two little more challenging poses for you to go and practice and understand the anatomy and physiology of those poses as well. And we'll see you in the next video.